What are called molecular motors? I want to know what is your answer. Question number 19. Should your answer, doc? 19? Yeah. Which is not a molecular motor? Arun B says D to the power of 4. Anuj Nigam says myosin. Deepayan Banerjee, A to the power of 4. Dynin? Come on. Anuj, don't break my heart. Actin is what you need to remember. So the myosin, kinesin, dynin, they're all called the molecular motors is what you need to basically remember. Now, which is an antiporter? One molecule moves in, one molecule moves out, is called as antiporter. SGLT1, where do you find it? Versus SGLT2, where do you find it? Is a very important question. Let me see what is your answer. Question number 21. Yes. Difference between SGLT1 and 2. Mention the question number. Yes. SGLT1 and 2. Good. I can see Gangadeep proposing B. Shoaib saying A. I know, all fight is between A and B. Ganesh Prabhu totally clean bowled. Duck out. So, it is the intestine. You have SGLT1 in intestine and kidney. SGLT2 in kidney. But SGLT1 is in the late part of the proximal straight tubule called S3 segment. And the early part of the proximal convoluted tubule, you have the SGLT2. Both glucose galactose are by SGLT1, but only glucose by SGLT2. And the glucose transport capacity is very high for the SGLT2 and very low for the SGLT1. And the renal glucose reabsorption is mainly because of the SGLT2, but not by SGLT1. You have to be 100% sure. Recently, AIMS question bank we discuss every day evening, no? We discussed one drug, which is an inhibitor of the SGLT2. So that is the reason newer anti-diabetic drugs are targeting the glucose reabsorption in the kidney is what you have to be very sure about. Right. Ashima says, sir, is it not RBC for SGLT1 and 2 for intestine? No. Not at all. See, these SGLT1 like questions are all microscopic questions. You don't see grossly. Aortic stenosis like topics are all macroscopic. You can feel the patient, you can talk to patient, you can remember it clinically that, oh, that day I did like that. But these are all micro kind of questions. And in exam hall, we keep getting delusions. Somebody will be talking to us, A is not right, B is right. That we have to overcome by being very emphatic on the high yield topics. Maximum smooth muscle compared to wall thickness. Where do you have? It is the terminal bronchiole. Gangadeep, C to the power of 4 is absolutely right. Now, during a 100-meter sprint, what do you use to meet the energy requirements in the muscle? It is the phosphocreatine that is being used. Golgi tendon organ. Now, this question is for sale. Try to bet on this. Question number 24. What is your answer? Golgi tendon organ, by which nerve is it innervated? So, I can see Vishwavardhini proposing 1B and a good number of you proposing B. Excellent, doctor. Proud of all of you. Nobody is saying other than B. Good. So, the Golgi tendon organ Afferent is this, whereas efferent, it is the 1B fibers that inhibit the motor neuron, and the motor neuron releases efferent called alpha motor neuron, and the Golgi tendon organ brings the afferent from the muscle, and the alpha motor neuron takes. Alpha motor neuron is the one which is there in all our nerves. We call sciatic nerve and all this nerve, right? Inside that, what you have is the alpha motor neuron efferent. That's what you need to remember. Now, the next question. Pain and temperature. Oh, cheapest question. Lateral spinothalamic tract. SGLT1 is located in intestine. Steroid synthesis mainly requires smooth endoplasmic reticulum where the steroid synthesis occur, and protein synthesis is in the rough endoplasmic reticulum. Now, fiber mainly affected by the local anesthesia should be a myelinated one. Which among the myelinated is it? Is my question to all of you. Question number 28. So, the sensitivity to local anesthetic, which is most resistant, most sensitive, is a favorite question of the examiner, doctor. 27. Please tell me, 28. I can see most of you betting on B versus D. Come on, yesterday only we discussed Vishwavardhini. Unmyelinated are not sensitive. Myelinated like AB are sensitive. Within AB, which is sensitive? That is very, very important. That's good. It is A delta is the one among the myelinated sensitive. What is the meaning? What is the meaning of rheobase? Rheobase is that minimum strength of stimulus which is required to produce the action potential is called rheobase. Just like our evening 6 to 8 p.m. classes, Chai Pe Charcha with Dr. Murli Bharadwaj every day. It is the minimum stimulus which is required for you. Remaining 22 hours you can sit and read. If you give 2 hours of your time in the evening to me, I will stimulate you enough to read the remaining 22 hours. That is called rheobase, is what you should be sure about. So please come every day evening 6 to 8 p.m. Since most of you want Diwali to be holiday, alright, let us excuse ourselves day after tomorrow. But tomorrow evening we have a class. Tomorrow is Naraka Chaturdasi, right? Day after tomorrow is Diwali. Huh? Wednesday is Diwali, huh? Okay. Then we will give a break on Tuesday, Wednesday, then we will decide on that. But tomorrow, let's all meet up in the class. Insulin moves the potassium into the cell. That is the reason we in hyperglycemia, what do? You give, hyperkalemia. Insulin plus 5% dextrose you give so that insulin moves the potassium into the cells. Gluconeogenesis, mainly where do you see? Obviously in the liver. Glucose 6-phosphate dehydrogenase deficiency, G6PD deficiency lead to hemolytic anemia. This is a beautiful question for sale. Let me see how are you going to bet it. Yeah. Come on. Bet it, doc, on this question. Essential fructosuria. Mark the question number 31. 33. Yeah. I can see Santosh Dubey proposing B. Gangadeep saying C. Yeah. Lakshmi also thinks C. Chaital, Lalit. That is the whole story, doctor. After coming out of exam hall, no, why did I do this wrong? We feel, na, this is one such question. I don't want you to feel that. It is the fructokinase, which is the essential fructosuria. See, doctor, fructose become fructose 1-phosphate. For that you require fructokinase, and that is absent in essential fructosuria. Please don't forget. Fructose 1-phosphate becomes glyceraldehyde, and it will shed out the dihydroxyacetone phosphate. And for that you require aldolase B, and the deficiency of that is called hereditary fructose intolerance. So this is the main difference which you have to basically Remember. Now doctor, very common question in the exam. Difference between essential fructosuria due to fructokinase deficiency versus hereditary fructose intolerance due to aldolase B deficiency. Which is more severe? Fructokinase is essential fructosuria, like essential hypertension. No symptoms. But hereditary fructosuria, fructose intolerance, hypoglycemia, hepatomegaly, jaundice, vomiting, it is a dirty situation. Just one enzyme, इधर उधर कितना फर्क है देखो. Aldolase B बोले तो जिंदगी मुश्किल हो जाता. Fructokinase deficiency है तो जिंदगी आगे बढ़ेगा. So, entrance exam is also like that. Sometimes when you are in the borderline between the topper and non-topper, hardly about 10 to 15 questions are all the difference. So be very sure. Treatment is not needed for fructokinase, whereas avoid sucrose and fructose is the treatment of hereditary fructose intolerance. Tomorrow agar exam mein question aa gaye to shoot it with a bullet. Be very sure.